Hey, hello. So today what I'm going to talk about is what's called the A1C. So if you're a type 2 diabetic or a type 1 diabetic or you're pre-diabetic, this is a lab test and it's something that commonly gets talked about. So my A1C is this, my A1C is that. But what I really want to do is kind of shed some light on what exactly does that mean. It's not just a number, it actually means something. So if this is relevant to you, you should probably take some notes and write some things down, because this is going to change your understanding and it's going to change your perspective. So HbA1C, or what people call A1C, is a blood marker. And what that marker essentially does is it indicates how much glycosylation is going on in your blood. So glycosylation is a chemical term basically that means that sugar is attached to hemoglobin. So I've got to give you a rundown of how this works. So if you have a lollipop and you lick the lollipop and you take that lollipop and you stick it onto the back of your hand, it has like a sticky, viscous type of feeling to it. And so that is how sugar essentially works in your blood. So what you're doing is, when you measure glycosylation, is you're measuring how much sugar is, hey Jeff, how much sugar is attaching to the hemoglobin that's in your blood. And the reason this is important is hemoglobin is what actually carries oxygen to the cells. So when you have red blood cells where hemoglobin resides, part of it is called hemoglobin. Hemoglobin attaches, oxygen, iron, and all these other things, and it brings it to the cells. So when your glycosylation, your HbA1C number goes up, what essentially that means is that sugar is getting in the way of where oxygen might otherwise be. So when you do that measurement, anything above 5.4 gets to be an issue. So when we look at those numbers, if your number is 8, that means you have way more glycosylation going on than what is normal. And so you're not delivering the optimum oxygenation to the cells and tissues. The things that are affected first are the most distal things, like the toes and the tiniest capillaries that go to like your kidneys and your eyes. And so these are the things that are usually affected most. So you might notice some problems with sensation. It's called diabetic neuropathy. Or you might have some kidney issues. You may have some vision issues. Nerves are also affected. And then ultimately, as this disease process builds and builds, then ultimately it affects cardiac tissue, brain, all of these things. In fact, now Alzheimer's is being called type 3 diabetes. So, and it's basically a result of a long-term systemic problem with insulin resistance, high blood sugar or glucose levels, and high insulin levels over a sustained period of time. The HbA1C number is an indication of how much of that's going on. So when your glycosylation number gets up there, when your HbA1C number gets up there, what you need to think about is that the cells and tissue that need oxygen are not getting as much as they should. This leads to things like tissue death, gangrene, necrosis, peripheral neuropathy, kidney dysfunction. All of these other things come with that. Now, the reason that they measure that in 3-month intervals is every red blood cell is replaced in about 3 months. So the good news is you get new red blood cells all the time. The bad news is glycosylation is irreversible. So if the blood cells that you have now are glycosylated in a high way, or their number is too high, that will not get better. They have to be replaced. So that condition is irreversible, and so it has to be replaced through normal body function, autophagy, apoptosis, all of those types of things that we talk about in fasting and all. But it doesn't get better on its own unless you make changes. So, and here's the problem. It's minimized. or it's thought of more colloquially. So it's like, oh, it's a number. My number was 7. Well, that's high. And so anything over 5.4, and I get concerned. So if your number is 7, you're going to hear from me. You know, I'm going to be like, whoa, that's way too high. You need to do something now. Oh, my doctor's not that concerned about it. Well, they either don't understand it, or they should be concerned, or both. So they should definitely be looking at it more cautiously. And it's not just the thing like, okay, we're going to give you more A, insulin, or B, drugs. It's serious lifestyle changes. So in a 90-day period, we can see significant changes in HbA1c if a person is willing to adapt the proper diet, lifestyle changes that they need in order to make those changes happen. But it is a serious thing. And here's some of the shocking things. So you could be, you know, a full-on vegan and have some pretty high HbA1c numbers because glycosylation can occur if you're eating a lot of starchy carbohydrates. Glycosylation can occur if you're eating a lot of bread and starches and grains. In fact, eating some meat actually imparts some benefit because there are amino acids in meat called carnitine and carnosine that actually resist glycosylation. They stop glycosylation from happening. So eating meat actually has some benefits to it. Nobody talks about that, and I've never heard that talked about, but we know for a fact that these things exist. It doesn't mean that you should eat a diet of all meat. I don't believe in extremes. I don't believe in veganism, and I don't believe in, you know, the carnivore diet. Hi, Lisa. So I don't believe in extremes. I think a combination, an omnivorous diet is the best. But I do not sleep on A1C. I do not minimize A1C. It is only part of the proper metabolic workup. And what it kind of says is, it says that your metabolism is broken or going towards broken. So this morning I was talking to a guy. He's got some pretty complex issues, but I was explaining to him, I said, we all know people who can eat anything they want, do anything they want. They never gain a pound, they never get sick, you know, and they have this kind of like this amazing metabolism. And then we know other people that it seems like everything they do is wrong all the time. So you can't compare yourself to the metabolically gifted people if you're not a metabolically gifted person. Like for me, if I do stuff wrong, I get fat and I have bad genetics in this regard. So I have to keep on top of it. Okay, that is what it is. So I keep on top of it. I keep close reins on things like this. I have tons of diabetics in my family, and so I know my genetics are not the best. This is why some of the things that I do, we talk about, like I've done some videos on fasting and also getting your heart checked with your coronary artery calcium scoring. Those types of things have benefit because they're kind of like warning signs to monitor. So what we can do is we can look at A1C and say, look, here's where it is. Let's say it's 6, which is not bad. A lot of diabetics would love to have an A1C of 6. But if it's 6, I'm not satisfied because I know that there is a low level of tissue damage that's going on. The problem with diabetes is it's a thief. It steals from you insidiously, slowly, over years and years. So it slowly robs you of that tissue oxygenation. It slowly robs you of your function. And you can't sleep on it. It never goes away. It keeps working. It's behind the scenes. It's rust. It's just depriving your body of much needed oxygen, and it's causing cell death. Now your body can keep an equilibrium. It can work hard. It can try to repair, reestablish normal function. But if this gets too far out of whack, then it's just a game of minimizing damage. Okay, so we've got this problem, we've got this problem, we've got that problem. We know two things. We know high blood sugar is bad. And here's what nobody seems to talk about. High blood insulin is also very, very bad. Here's why. Insulin is an anabolic hormone, which means insulin triggers growth of cell and tissue. And that is, it sounds good, but there are times when there are stop points being placed out. Like, so when on muscle, insulin can cause a regulated growth of tissue. But inside the vessel, inside the arterial lining of a vessel, if the vessel's like this, high insulin level in here can cause the arterial walls to grow and thicken, essentially making that hole smaller. One of the things that shows up there is hypertension. So a person may have high insulin levels and they get diagnosed with hypertension. And it's because high insulin isn't measured. It's not done on a routine blood test. So I'm going to show you a blood work of my patient. I blacked out all the relevant info, so you won't know who this person is. But if you could see this says glucose, and her blood glucose is there. And then I'm going to swipe that thing out of the way. And then here is her HbA1C, and it's 5.5, which isn't bad. So most family practitioners or doctors would look at this and say, oh, she's fine. Except I also ran the fasting serum insulin, and it was 33.4. That's over 6 times normal. So what this essentially says is her body is not damaged yet. Yet is the operative word. So she will begin to have tissue damage because the insulin is way too high. It's causing, her body needs 33.4 units of insulin during a fasting state to maintain blood sugar. So this is a broken metabolism. This person, their metabolism is broken. When you have 33.4 on insulin at a fasting state, you can't metabolize body fat as energy. So your ability to transition from a glucose burning metabolism to a lipid burning metabolism is broken, and or it's not lost, but it's pretty banged up. So getting her to get into a fat burning metabolism is going to be very challenging. Insulin prevents lipolysis. That means burning fat as energy. Breaking fat means actually breaking fat. High insulin level will absolutely prevent it. So what that insulin is doing is waiting for sugar to come in. And so if I were to make a graph, and this would be normal blood sugar, every time you eat, that sugar comes up like this. Well, when people have a lot of insulin resistance, their sugar comes up like this. The body makes insulin like this, and it's not enough. So then it makes more insulin, and then you fall below, so you have suboptimal, and then you crash. And so this is a person who gets jittery, shaky, can't go without meals, can't lose body fat, has lots of fatigue, may have other endocrine disruptions, because insulin, again, is an anabolic hormone, but it also interacts with some of the sex hormones. So you might notice that for men, their testosterone level goes down. For women, their progesterone level may go down, but their estrogen level may come up. There's also some intricacies there that need to be looked at through lab tests. So that's a generality. Don't quote me on that exactly. But for men, when we know that they have high insulin levels, almost always they have low testosterone levels. So this is a guy, he's getting fat around the waist. He may have sexual problems. He may be moody, miserable, all of these different things. He might be hypertensive. He's probably on blood pressure medicine. He's probably on a statin drug. So they're just making him sicker with the drugs that they're giving him. And it's all because insulin isn't properly managed, or in the worst case, it's even measured. So I always tell folks, get the darn insulin test. It's a $10 or $12 test. If your doctor doesn't want to run the test, ask them first. Say, please run this test for me, and they may ask you why. So one of my buddies and a person that I'm actually counseling, I asked him to ask his doctor to run the test, and the doctor asked him why he wanted it, and he told him, and he goes, okay, it makes sense. Boom, that's great. That's the ideal situation. You want your physician to be part of your team, because you're working together to create the best possible health outcome. I think that's how I view it. So the other day I was talking to a type 1 diabetic, and she's been type 1 diabetic for a very long time. And I started to explain HbA1C and tissue oxygenation and why it matters and how using more insulin is not good. And just getting the why, having her understand the why, was enormously important for her because she didn't understand it. She knew that the numbers meant something, but she didn't have a deep understanding of what the numbers actually meant. After we had the conversation, and I have to tell you, it was kind of like it was a tough conversation because she cried. You know, I said, here's what happens when your A1C number is high. Your tissues are dying. You're creating dead, dying, and diseased tissue. And, you know, she cried, and she said, well, I just didn't understand it. Of course you didn't understand it because it's not intuitive. You don't immediately get what that means. And so if we can get everybody to understand, then they can they'll make the how happen. So get the why we want these things, the how you can make happen. So then after we had this conversation, she said, I'm going to make changes, and she did. By midweek, she was already asking to lower her insulin. By the end of the week, when I saw her yesterday, her fasting blood glucose had now been in the normal range, which it had not been in a long time. And this is a person who's been diabetic for a long time. So simple changes can make big results, but you need to know, you need to understand. So I have a group called Metabolic Programming, and it's a Facebook group. It's free. You can join that. You can just request and I'll add you in. But this is where most of this content's going to wind up. So I'm going to go into greater detail on metabolic issues, both for diabetics and pre-diabetics. Right now in the United States of America, we have 100 million people who are considered to be pre-diabetic. And so I've lectured on this, I've talked about this, I've done some group talks and things, and you know, the full ramifications for that have not been seen, but they will be seen if things keep going the way that they are. There's a lot of things that are kind of messing up for people, getting in their way of them, you know, getting the results, and it's not their fault because they don't understand all of it. They don't understand, you know, they don't have the medical knowledge or training, so they don't really get it. So they might be making decisions which they think are good decisions, but they're not good decisions. So, and I don't want to place blame, but once we give you the knowledge, once you know what to do, if you continue to make bad decisions, that's definitely your fault. And you don't have anybody to blame. But this is important. This is stuff we're going to talk about. So, if you have problems with your glycosylated hemoglobin, HbA1C, you have problems with your blood sugar. And so your blood sugar, you should look at all of your blood work and look at trends. So if your fasting blood glucose were, let's say, 80, and then it was 90, and then it's 100, and then it's 110, that's a trend that's suggesting you are insulin resistant. Even without knowing what your fasting insulin level is, if I know your glucose levels are trending up, I can also guarantee you that you're probably very insulin resistant and your insulin levels are up too. However, it's always better to know. Get the test. It's not an expensive test. If your doctor won't do it, get it done yourself. I have a direct portal, and if you want that, I can give that to you, and you could order your own blood test. You know, it's not an expensive test. It might cost you $20, $30, it might be $10. It's not an expensive test, but it's worth it. It's worth knowing. So you want to look at that. You want to look at your fasting insulin. You want to look at your A1C numbers. You want to look at your glucose numbers. You also want to look at your triglycerides. Triglycerides are basically fat going towards storage. So once your liver and your muscles are full, once they can't take more glucose, then the body begins to tuck this fat away into the fat cell. It turns it into triglyceride, and that is what's in your blood. So there's things we don't want at high numbers in our blood. We don't want high triglycerides. That's bad. We don't want high blood glucose. That's bad. And we don't want high insulin levels. Those are also bad. Some of all of those is fine. High numbers of any of those is not fine. So this is stuff we have to look at. It is a balancing act, but it is, you need to know, you need a coach basically to look over your metabolism and say, what the heck is going on here? This is not good. This is not good. You need to know what supplements are good. You need to know what's out there. You need to know if they're effective. There's a lot of stuff out there that I wouldn't recommend. I looked at a company's glucose management product, and they were, making this as something they could distribute through doctors. And I looked at it, the first ingredient I disagreed with. I won't give somebody that. I won't take that. I don't like that particular issue. I don't like that particular starch that they're using, and I don't think it's efficacious. I think it's not going to work. So you have to have some knowledge of all these things. This knowledge empowers you. So I am open to questions. I do one-on-ones. I have one this morning. I will talk with you. I will try to absolutely educate you, make you understand, help you answer your questions, because this thing I care about a lot. I really do. So like I said, get these things hammered out, get a good knowledge of it, and then more importantly, empower yourself. Get the information so you can understand what these things actually mean, and then you'll be able to make the best possible decisions, because this is your health ultimately. Your doctor has thousands of other patients, so does the doctor know every single thing going on with every single patient all the time? It's next to impossible. So they're going to miss stuff, and it's not that they're bad doctors, it's that they're human beings. And they also might not think of it or have that level of understanding where they know what all these things mean at a deep level. So, I want to empower the people. I want to empower people to make good decisions. And so education is part of that process. So if you're interested, join Metabolic Programming. Ask to come in. I will approve you. You can ask questions. I'll put videos like this in there. If you need or you have an existing problem, again, get in touch with me. I will help you. I will be doing, finishing, I've been working on it for 2 years, but I have a book about this coming, and I also will have a home study course. Basically what this will be is a number of videos and documents and things that you can go through, and you could help yourself, and you could know what blood work to do and all that. One more thing, and it's kind of like a little bit beyond what's normal, but type 2 diabetics on insulin. So if you're type 2 diabetic and you're taking insulin, there's a test called C-peptide test. And I was just talking to a fellow this morning about this. C-peptide test is what distinguishes the insulin that your body is making from the insulin that you might be injecting. So you're type 2 and you're getting insulin, you want to get a C-peptide test. And that C-peptide test is going to allow us to know what's the remaining insulin that your body's making. It's going to differentiate the exogenous or outside your body insulin from your endogenous or naturally produced insulin. So that's a good test to have, because it lets you know how far down that rabbit hole you've gotten. Is your body still making insulin? If your body's not making insulin anymore, then you're going to have to inject insulin. There's just no way around it. You won't survive without it. But if your body still has that capacity, then we want to try to get you off as much of that exogenous insulin as possible, off of those anti-diabetic drugs, and manage you with the proper diet, the proper supplementation, the proper exercise, the proper sleep, all of these other factors that can make you healthy, build health rather than just treat sickness. Okay, so that's it. Join Metabolic Programming. Ask questions in here. If you get value from the videos, if you think the video, somebody should see this video, like and share. Please please share the videos, because we want people to get information. I want to empower as many people as possible to make changes for their health in the positive direction. I'm going to do another video probably next Friday, and I'm going to talk about something that most people have never ever heard about before. It's called interleukin 6, Interleukin-6 is an inflammatory cytokine. So, and there's a story behind this. I have a patient, he has a lot of problems with what they have diagnosed as rheumatoid arthritis. He's on prescription drugs for this, and so I looked at what tests he had done, and then I said, well, nobody's ever checked this. So I ran his interleukin-6, and it was 15 times the upper end of normal. So the thing was, even though he was taking Humira, he was on these drugs, this inflammatory cytokine was just way off the chart. And so we have a strategy for this. And, you know, and so you're never going to feel well if this is off the chart. So not related to this, but kind of related in terms of health. If you have questions, if you have a topic, if you have something you'd like me to talk about, where I'm going to give you my approach, my more natural approach, the things that you can do with diet, with exercise, with supplementation, with changing your lifestyle behaviors, that's what I do. So throw that out there. I will address it. If I have something meaningful to contribute, I will. I am always learning, and I do this all day, so I'm always reading, always trying to get better knowledge, always looking at what's out there, always reading other experts, sometimes agreeing, sometimes disagreeing, but I'm in a process of trying to get better as well. So, you know, we take this journey along the way with both of us. So any questions or anything, please put them in here. Again, share videos, go to Metabolic Programming and join Metabolic Programming. Again, free, all information free. If you need a one-on-one, be happy to do it. That's it. Have a great day. Enjoy your weekend. Take care. God bless. Talk to you soon.